starting your timer, and here is your question.
Okay. I wait for the bell or can I start?
You can just read the question. 1 minute to read the question, and then
Okay,
you'll hear
that's
the
good.
bell.
Okay.
Then I will instruct you to start.
Okay.
Right. So if you have read and understood, considering it history taking station, kindly please begin.
Okay. Good morning, sir. Good morning.
Good morning. Yes.
Hi, doctor.
What is your
Hello.
examination candidate number?
Okay, my candidate number is 2103.
Okay, good. Continue.
Okay. Shall I start?
Yes, please.
Okay. Hello.
Hi,
I am Dr.
doctor.
Ahmed, one of the hello. I am Dr. Ahmed, one of the surgical team. May I confirm your name and age?
Yeah, I'm Liz Anna, 54-year-old.
Anna?
It's a man.
I'm
I
Liz
can't
Anna,
hear him well.
54-year-old man, 54-year-old.
54 years old.
Okay.
Okay.
Okay. I have asked to ask you some questions about your condition today. Through that I will take down, write down some notes. Is it okay with you?
It's
Yes.
okay, doctor.
How can I help you today?
Yeah, thank you, doctor. I've been having this difficulty swallowing solid food for about 10 months now. And just recently I noticed it has gotten worse. When I have difficulty in swallowing liquids. And about 2 months ago, I noticed loss of appetite. I can't just feel like eating anything, and losing weight.
Oh, I am so sorry to hear that. Must be difficult for you. We will ask you some questions to sort it out together. You just mentioned this is first start 10 months ago, and over the last 2 months you noticed also weight loss. That's okay?
Yeah, that's correct. That's correct, doctor.
So this difficulty of swelling is increasing in course. It started for
Yes, it has worsened. Now I
solid.
even have difficulty in swallowing liquid.
Yes, and now wait for the liquid. Oh, I am sorry, it must be difficult. Have you changed? Do you have? Do you noticed any change in your appetite?
Yes, I don't even have appetite at the moment, doctor.
Oh, okay. Have you noticed any vomiting?
No, I'm not vomiting. No vomiting.
Okay. Any history of trauma to your chest or your upper tummy?
No, no trauma at all, doctor.
Have you noticed any difficulty in breathing?
No, my breathing has been fine.
Okay, that's great. Do you have the sensation of burning sensation while swallowing or sharp pain in your food pipe?
No, no pain at all. Just discomfort
Okay.
in swallowing.
Okay, I'm sorry for that. Have you experienced any bowel change recently?
Pardon?
Bowel changes.
Bowel habits change.
No, not at all.
Have you noticed any rash in your body?
No,
Any-
not swelling my abdomen.
Any joint pain or back pain?
No, doctor.
Okay, that's great. Any morning stiffness in your joints?
No.
Have you noticed any neck swelling recently?
No neck swelling.
Well, forgive me for asking that. Have you noticed bad odor breath recently?
No.
Have you noticed any gurgling sound after you drinking?
Have I noticed what?
Gurgling sound.
Any gurgling sound after you swallowing or drinking?
No, no,
Any regurgitation of food when you lie down?
no. That happens occasionally.
It happened occasionally. True?
Yeah, it happens occasionally.
Okay. Have you noticed any dry eye or dry skin of your hand?
No, no, no.
Any numbness or weakness in your arms or your legs?
Not at all, doctor.
Okay. Have you noticed any fever or spiked temperature recently?
Yeah, I have this fever occasionally in the night.
Fever at night? Or
Yes.
any sweating at night also?
Yes, I do have sweating too.
Okay. Now I will move on some question on general health. Have you diagnosed with any other medical condition?
Just, I'm hypertensive and I'm on medication.
All
Do you
right.
take regular medication for that?
Yeah, I'm not
All right. Can you please summarize your history taking now?
Okay, today I have spoken to Mr. 55-year-old,
Yes.
presented with dysphagia, which is progressive in course, started of 10 months ago. Over the 2 months, he also reported that he has weight loss around 2 stones of his weight.
Yes.
This dysphagia started with solid and now progressed to be solid and liquid.
So what are
He
your
has
provisional and differential diagnosis for this patient?
with based on that my main differential or my top differential is esophageal cancer, and
Okay.
also should consider esophagitis or gastroesophageal reflux disease,
Yes.
even pharyngeal pouch or thyroid swelling goiter or
Yes.
myasthenia gravis,
How would you?
maybe
Yes.
achalasia.
Yes. Thank you. How would you confirm your diagnosis? What investigations would you ask for?
Whereas after do full clinical examination of the patient, we should go for laboratory investigation, take blood tests, full blood count, base renal and renal baseline, and create liver function test. And after that, we should do standing X-ray. After that, barium swelling. After this barium swelling, we can consider if it is achalasia or not. After that, we can do endoscopic ultrasound. Lastly, we can do CT for staging if it's
Very
any
good.
malignancy.
Thank you. Can you tell me what treatment alternatives can you offer to this patient?
After, based on what found in the investigation, if it is resectable malignancy, we can do a total esophagectomy with chemoradiotherapy. If it is advanced stage, we can go for a palliative treatment, right? Metallic extending stent or feeding tube via jejunostomy,
Right.
and the palliative treatment, right? Painkillers.
Yes. If time would have allowed you, how would you have completed your history?
I cannot ask it about the family history of any cancer,
Yes.
any previous history,
Yes.
and any previous surgical histories.
Yes, please. And if you know, in history, we ask about idea, concern, and
Yes, idea, concern,
Expectation.
and expectation.
Expectations, yes. So this is also one thing that you would have you could have asked if time would have allowed you. And you have also assessed severity. Did you ask about any pain?
Yes,
If patient,
I asked for any pain or burning during swallowing.
any dysphagia, dyspepsia you asked. Okay, hematemesis, bowel. Oh yeah, you did ask that. Okay. Any other constitutional symptoms?
Yes, I didn't ask about the constitution
Yes.
symptoms.
In the beginning, you didn't ask about how it all started, because patient has already said that it started 10 months ago, but then you didn't ask about when did it start, how it all progressed. It started obviously 10 months ago, but then how it started. That is like one question you could have asked.
You mean it started gradually?
Yes.
He said that
Progression.
it started first for solid and then for solid and liquid. It's sure it's be started
Yes,
gradually.
and
I consider it done, and I like to deal with it as a summary. I summarize what he said to
yes,
cover this point.
yes, and the timing you could have asked if it is if patient experiences the symptoms all the time, or is it just sometimes?
Oh yes,
Because there
yes,
could be associated with the time as well. And maybe you can ask if patient feels something stuck in the throat while swallowing. Then it would give you an impression that it is intramural lesion is intramural or is it extramural. So if you'll ask this will rule out the kind of lesion patient could have had or could have be suffering from.
Okay,
So
I get
yes,
it.
yes, very good. And one time you said when patient was saying negative symptoms, you said that is good. That is great. You said in this one, it is very important to use. I'm really sorry to hear that. Like every time you have to show sympathy to the patient and empathy as well. So by no means, no symptoms, not having any symptoms is not great. So by no means you'll use the word great or that's okay, that's good. All right, you say okay, or you say okay or all right, but not good or great. These words,
Okay,
yes, very good. Thank
it's a
you.
great comment for you. Thank you. But no problem to say too much and much. I'm sorry. I'm sorry. I'm sorry.
If you can't always say I'm sorry, you can say really sad to hear that. I can really empathize with you. Like in other words, you can say the same thing, but use the other words, not exactly I'm sorry, because it becomes very monotonous. So you can say really sad to hear that. I can imagine. Yes, I can imagine how painful could that be for you. I can imagine it's really terrible. It's giving you a lot of problems. So by using other words than just sorry, you can exactly show the empathy. So use of more vocabulary.
It sounds so monotonous.
Yes, if you'll just say sorry all the time. Good, very good.
Okay.
Thank you.
Yeah, one thing I noticed is that when you ask me, well, how can you help me today? I've given you quite information which you are not meant to repeat. The way you repeated it is also very good. You repeated what I said. You're supposed to just move on from there. Meanwhile, you started asking questions that I gave you, that I offered you already. You're still asking me whether I have loss of appetite, which I've supplied you already. Just to ask few more questions to characterize the difficulty with swallowing. Then you just move to your constitutional symptoms. The loss of appetite and weight loss are one of the constitutional symptoms. That's you need to have probably the feeling well, that's Monday. The patient is having fever, which you asked. Then once you leave that, the next will be to ask your eyes, then go to personal history, drug history, family history, social history, then systemic review. And you conclude. But you took a lot of time trying to phantom out same thing that I've said.
Yes.
Actually,
I run them as a
right into your
timer.
time so much.
Yes.
Good, thank you.
Yes.